Hi, and welcome to Chapter and Verse. This is week number 1 of a 2-part series with a fellow whom I'm proud to say is my friend, Dr. Timothy Flanigan of the Brown University, he's professor of medicine at Brown University Medical School. And we're dealing with a topic today which is of apparently great interest, and we're going to look at it piece by piece. We're talking about gender dysphoria and why it is that boys want to be girls and girls want to be boys. When we were in grade school, nothing like that ever happened to us. I mean, we had a social problem. There was one child in my entire school, 16 rooms, eight rooms per A and the B, so that's 16. There was one child who was going through a situation where his parents were getting a divorce. But that's as close to chaos that we came when we were younger. Now we have boys and girls who want to be the opposite sex. And one child went to his parents and said, what's the opposite sex? And I don't know if they had a word for it, but people are having thoughts about it today a great deal. This seemed to have come upon us quickly. How did it happen, Tim?
Boy, Ray, this is such a big topic.
Yes.
And gender dysphoria is a charged area.
Yes.
And it's part of the whole culture wars, which is really very intense.
So true.
Yeah. I'd like to start with the words from a song by Tasha Layton. Is that okay?
Yes, of course it is.
So I'm going to read it out. You may have heard this. It was on K-Love. But when this broken world is breaking me down, when my tears and knees both fall to the ground, when my questions make me doubt you more than ever, you remind me that your answer's always never. Never forgotten, never forsaken, never abandoned, not for a second. I am safe in your hands, always and forever. You're never not working, my heart is the proof. There's not a broken too broken for you. Will there ever come a day when you're not holding me together? You say never. Every single time I look back, I see there's never a promise you didn't keep. You don't waste the wounds. You use them for the better. When it comes to you, your answer's always never.
Wow.
And the reason I like this is it brings us back to the human person.
Yes.
And a lot of discussion about gender dysphoria, people talk about, well, this side or that side. Mm-hmm. You know what? They forget the human person is at the center of it.
Yes.
You know, one of the big problems with our society is that whether you're talking about adults or adolescents or youth or trans boys or girls, people always say things are fine, but we're not fine on the inside.
Yes.
That there's so much pain. There's really so much anxiety and depression, almost a cauldron of emotions.
Yes.
And yet we don't often acknowledge it.
Yes.
And so many people that suffer gender dysphoria are so alone.
Yes.
They feel they're alone. I mean, you're going to be a little shocked by this, I think. One woman described her experience of spending decades in a body that feels simultaneously dead and like an eternal wellspring of agony.
Yes.
And that's real pain and anguish.
Oh, yes.
And that's real anxiety.
Yeah.
That's real depression.
Yes.
So the question is, when you feel this way, so many folks are alone.
Yes.
Nobody's listening to them.
Yes.
Nobody is able to spend time with them.
Yes.
And try and understand. They did a survey of over 6,000 individuals who identified as trans.
Yes.
And more than half of them have a family member who refused to speak with them.
Oh.
And a lot of them have been caught up in drug use. There's a lot of addiction.
Yes.
Sometimes the sex culture or even the sex work.
Yep.
Many folks who are trans can't find work.
Yes.
They feel so alone. And they don't feel they have any support except maybe in the online community, but that's not real people always.
Right.
Sometimes just in the trans community. So we have to understand that for every single person that has gender dysphoria,
Yes.
they're not this or that.
Yeah.
They're a person, they're a child of God. They're an individual.
Yes.
And they need to be listened to, cared for, hugged. They need
Yes.
they need that attention. What happens is that sometimes we forget that.
Yes.
And this is a quote from Jason Everett, and he wrote a great book here called Male, Female, or Other by
Yes.
Jason Everett. It's really spectacular. But his quote is, each one of us is not a problem to be solved, but a mystery to be loved.
Yes.
Isn't that something?
Yes.
So each one of us is not a problem to be solved, but a mystery to be loved.
That's beautiful. Somebody once told me, he said, being a parent, he said to me, is the hardest job you'll ever love.
That is an interesting way to put it. That's the hardest job that you're ever going to love,
Yeah.
because it's all consuming.
Yes.
Yeah, and it's particularly hard when your own child is going through
Yes.
gender dysphoria.
Oh, yes.
So I got a lot we should talk about, because there's a lot of information here that people
Yes.
need to understand.
Can I ask a couple of questions?
Please.
Because it's occurring to me now, and I become as forgetful as some other people too. My children say, Daddy's having a senior moment.
Yes, we have senior moments, that's right.
And my son Nathaniel, he said, don't worry, Daddy, you took care of me when I was little. I'll take care of you when you go through your second childhood.
That's pretty good.
Yeah.
That's nice of him to say that.
Yeah, it was beautiful. But how does gender dysphoria take place? It used to be a matter of counseling, but now it's become, as you say, part of the social milieu.
Well, are you ready to go through a lot of information here?
Yes.
Okay, so I'm going to go through my notes here, because I think I don't want to just give impression, I
Yes.
want to give information.
Yes.
Okay, so we'll do that together. So I'm going to talk about what many young people go through,
Yes.
how many of them feel that they're trapped in the wrong body,
Yes.
that they were supposed to be a guy or a girl, but they're not the biological sex that they are. They feel that they're born in the wrong body, trapped in the wrong body.
Yes.
That's what they describe.
Yes.
And then I'm going to talk about the gender affirmation care model. Sometimes it involves social transitioning, medical transitioning, or surgical transitioning,
Yes.
and all the problems with that.
Yes.
Social transitioning is where you may be born with the external sex characteristics,
Yes.
say, of a girl, but you identify as a boy. And so you may dress as a boy, you may change your name to be a boy, you may use expressions and act as a boy. That would be social transitioning.
We've seen examples of that.
Medical transitioning is where you take hormonal therapy, where you would block puberty
Yes.
and take cross-sex hormones. So you would develop the sexual external characteristics based on that hormonal therapy.
Yes.
And then surgical transitioning
Yes.
is surgical treatment,
Yes.
which is, as you say, very shocking.
Yes, it is.
And it does involve usually top surgery, where a individual born as a girl
Yes.
will have a bilateral mastectomy, or chest surgery where they'll cut off both breasts.
Yes.
Or for a person who's born as a boy, they'll choose bottom surgery,
Yes.
which involves
Right.
surgical castration, removing the testicles, and surgical therapy there. And there are different varieties, but we're going to talk all about that. You know, a lot of people just want to talk about gender ideology.
Yeah.
Now, the issue with that is gender ideology is part of the culture wars.
Yes.
Now, this is a Christian show.
Yeah.
Many people talking about gender ideology, they think everybody who's a Christian is an enemy. They'll consider you and I, if we're practicing Christians,
Yes.
they might say, oh, you're a hateful, transphobic, right-wing fanatic.
Oh, yes.
And other people will say, if you are a proponent of, say, the gender affirmation model,
Yes.
they'll say, oh, well, you're probably a confused left-wing snowflake. Now, the problem with that is
Yes.
you can compare that scene to a husband and a wife
Yes.
yelling and screaming at each other
Yes.
with a child who's distressed sitting there on the floor between them.
Yes.
So what I want to talk about is the child with gender dysphoria.
Yes.
I'm not going to go into all the political aspects of gender ideology.
Yeah.
Because I want to talk about the person, and that's why I started with this song by Tasha Layton.
Yes.
That we're never abandoned, never forsaken, never forgotten.
Yes.
So we go back to the person.
Yes.
Okay, now, I have to start by saying, who am I?
Yes.
I'm on the faculty at Brown Medical School. I'm an adult physician, an infectious disease physician. I'm also a practicing Catholic Christian and a deacon.
Yes.
What am I not? I'm not a pediatrician. I'm not an adolescent doctor.
Yes.
I'm not an endocrinologist. They deal
Yeah.
with only hormonal therapy, for example.
Yes.
And I don't practice gender affirmation or transgender care.
Yeah.
Okay? So I'm really speaking from that perspective.
Yes.
So you asked, how do we come to this? How do we get to gender dysphoria?
It seemed to happen so quickly.
Didn't it? Yeah. So gender dysphoria, I'm going to read it to you. It's the term that describes the condition and distress from conflict between the gender that you experience or express or identify as, which is different from your biological sex. So for example, I was born a girl, I've lived as a girl, my family's treated me as a girl, but I'm really a boy.
Yes.
So the technical language is it's a marked incongruence between one's experienced or expressed gender and assigned gender for at least 6 months. And so there's a lot of clinical distress. Now,
Yes.
clinical distress, that's a clinical term.
Yes.
What it means is anguish.
Yes.
The people who feel that they're in the wrong body, this is an awful thing to experience.
Yes.
With terrible depression, anxiety, distress, and anguish.
Yes.
Okay? And people have trouble coping with it.
Mm-hmm.
Now, let's start from the beginning.
Yes.
Biological sex is determined medically by your external sex or genital characteristics.
Yes.
You have the genital characteristics of a boy or a girl.
Yes.
And that's determined by the chromosomes in your body.
Yes.
So women have the XX chromosome.
Yes.
Men have the XY chromosome.
Yes.
Okay? Now, the actual gene that's responsible for being male genital characteristics is the SRY gene, which is on that Y chromosome.
Yes.
So that's how you end up being born what would be called, what is, a boy with a boy's genital characteristics. What's happened, which is new or relatively recent, is that gender has been disconnected from sexual characteristics. Okay? So gender now suddenly is separate. And the WHO, World Health Organization, says gender identity refers to a person's deeply felt internal or individual expression of gender, which may or may not correspond to their physiology or designated sex at birth.
I hear
so
you.
it's an internal sense.
Yes.
Do you believe that you are, not what you should be, but you are
Yes.
a boy or a girl? So gender identity is how you feel and identify inside. And the only one that can determine that is yourself. So it's entirely subjective.
Yes.
It can change.
Yes.
And there's no test for it, okay?
Yes.
So trans people don't feel they should be a boy or a girl.
Yes.
I mean, sometimes we all have thoughts along those lines.
Yeah.
They feel they are a boy or a girl, but they're trapped in the wrong body. It's like being forced to write with the wrong hand.
Yes.
So you can understand this distress that occurs. So now, in some studies, a third of individuals who identify as trans consider themselves non-binary. So what's that
Yes.
term, non-binary? That means neither boy nor girl. So they might want to identify as any gender or neither gender, or that it's fluid and back and forth.
Yes.
So many individuals will state that their gender preference has occurred since birth, but many individuals, it will change over time.
Yes.
So non-binary is particularly common among young females that are drawn to it.
Yes.
And as you mentioned, there's been a meteoric rise
Yes.
in individuals born as girls, and as they approach puberty,
Yes.
saying they're trans, they identify as being non-binary or identify as being a boy.
Do they say why?
So this is just how they identify. Many of the individuals born as girls, trans boys, shifting identity to boys,
Yeah.
right, will make little effort to adopt stereotypical habits of boys
Yes.
or men. So they're not necessarily going to go out and watch football all day long.
Yeah.
They're not going to necessarily go out and do the crazy, violent video games 24/7.
Yes.
Right? They're maybe comfortable with their creative self that's not stereotypically male or female. They often will not identify with what is stereotypically womanhood, and they may reject a feminine identity.
Yes.
So they may be, so every person's story is different. This gets
Yes.
back to what we talked about in the beginning.
Yes.
It revolves around the person. And you can't, nobody is a problem, nobody is a type, nobody is this or that. Each person is a person
Yes.
and is a child of God. So that means hearing their story, which is so important.
A quick question.
Yes.
In college, I took a course, and they said, we're given to understand that it was Alfred Kinsey who started the multiple gender. You know, a
Yes.
guy can be 50% guy, 50% gal, or a guy can be 100% gal, a gal can be 100% guy, or maybe 20% guy. And it's really fluid, they say.
That's that understanding.
Yes.
So this term of gender dysphoria just came about in 2013. Before that, it was called gender identity disorder.
Yes.
And that disorder is defined as a disconnect between one's body and one's identity.
Yes.
Now, I just want to do a few terms because this is important.
Oh, yes.
Trans refers to transgender,
Yes.
right? A
The
trans
movement.
man refers to a female who
Yes.
identifies as a man, and a trans woman refers to a male who identifies as a woman.
Yes.
And we talked about how you can transition both socially, which is one thing,
Yes.
how you dress, how you call yourself, your expressions, how you act with others, that's social.
Yes.
You can transition medically with puberty blockers. You block
Yes.
puberty and then cross-sex hormones. And you can transition sexually. Now, it turns out 50% of individuals who identify as trans have received cross-sex hormones, and 25% go on to surgery.
Yes.
Turns out women are twice as likely to receive surgery as men, and that's almost all top surgery. Now, if you go back 20 years, Ray,
Yes.
it turns out that gender dysphoria largely affected older men or young boys.
Really?
But over the last 10 years, there's been a meteoric rise
Yes.
in girls or females approaching puberty. So in Sweden, females being diagnosed with gender dysphoria rose 1,500% between 10 years, from 2008 to 2018. So 1,500%. In
Yes.
UK in 2009, there were only 77 patients requesting services, the largest gender clinic. By 2022, it was 3,895 children, almost 4,000. And the vast majority were girls at birth
Really?
that were growing up and approaching the age of puberty.
Yes.
Now, if you look at long-term studies,
Yes.
which enrolled children prior to the recent surge, so these would be children that was then diagnosed as gender identity disorder, 80% of them, that's 4 out of 5,
Yes.
their gender identity disorder would desist, and they would identify with their biological sex 10 years later.
10 years?
So this is without hormonal therapy,
Yes.
without surgical therapy.
Yes.
So with those that had gender identity disorder, 80% of them ended 10 years later.
Yes.
Their identity corresponded with their biological sex.
There's almost a biological calendar.
Well, those long-term studies showed that data.
Yes. Yes.
Now, you look at individuals that have gender dysphoria, and they've
Yes.
shown different rates of mental distress as well as mental disorders, and that
Yes.
includes depression and anxiety, and neurodevelopmental disabilities. That includes autism. Okay? So in one study, over 50% of young people had one or more diagnoses of depression, anxiety, adjustment disorder, or autism. There's a report published by the American Academy of Pediatrics, and psychological hospitalizations were 20 times higher.
Yes.
Reports of self-harm, 50 times higher. Okay?
Wow.
And suicidal ideation, so thoughts of suicide, 20 times higher in trans youth. So in the National Transgender Discrimination Survey, suicidality for those identifying as trans or non-conforming was over 30%. Now this is in the same range
Yes.
as other young individuals that have suffered significant PTSD, sexual
Yes.
trauma, or returning veterans that have
Yes.
suffered significant trauma. So we see this in many other
It seems
conditions.
to be a chaos or a calamity of the soul.
Well, that's an interesting observation. So for gender therapists or many care providers in gender-affirming medical surgery clinics, the psychological distress is so profound, they want to help them. They want to do something.
Yeah.
And they do want to respond, and now many will disagree with this, but I think there's an inclination to say, gosh, if we can only match their biological characteristics with their identity, maybe we can solve much of this. And as we started out in the beginning, individuals are a mystery to be cared for.
Yes.
They're not a problem to be solved, okay?
Yes.
Now, it turns out that many patients with gender dysphoria, many
Yes.
of young females that wish to transition to men, or many males that wish to transition to women, many of these patients are deeply isolated from family and close friends. So
How
they're very
tragic.
isolated. It is tragic. Many of the relationships are online, and they're only getting information from the trans community. And the only affirmation as a person they're getting is from the trans community.
Is that what they call
And the
love
online
bombing?
trans community gives them affection,
Yes.
attention, and meaning.
Yes.
We all need all of that.
Oh, yes.
We all need affirmation.
Yes.
We all need meaning. We all need to be listened to.
Yes.
But for many of them, that's the only place they're getting it. And that is a real concern.
Yes, it is. Especially with people who are in danger.
So for many of the practitioners in gender-affirming medical practices,
Yes.
they believe that if a person identifies as trans, they should be affirmed in their identity and empowered to transition sooner rather than later, quickly. And that when others refuse to do this, it can cause unnecessary stress and anxiety. And there's pressure to do this in an earlier age. Because
Yes.
if you can block puberty,
Yes.
that individual won't develop many of the biological characteristics that correspond with their sex at birth.
I see.
So they believe this might solve much of the psychological pain and lessen suicidality. Okay, I'm going to quote this point of view.
Yes.
So you understand, people say, well, who are these? What does it mean to be a gender-affirming practitioner?
Yes.
Well, I'm going to quote this point of view so people understand it. These are practitioners that care for trans patients and care a lot about them.
Yes.
And so these are not, nobody's trying to harm anybody.
Yes.
They're trying to address the significant psychological pain that the patients are in.
Yeah.
But what they'll say is, sometimes when children are exploring their gender, this is quotes from practitioners, going through puberty can cause tremendous and unnecessary distress to some young people. If we get kids early enough, we put them on puberty blockers. We can give them medications that keep their bodies from progressing to the wrong puberty, quote unquote. Then we can put them to the right puberty, that would be with cross-sex hormones, that corresponds to their identity. When they go on cross-sex hormones, or if they receive surgery later, it gives them a body that's closer to their internal gender identity. Then, this will not only relieve the dysphoria, but make them less suicidal. Then, if a person decides puberty blockers aren't right, they can just resume puberty. As another clinician explained, this is just like the good thing about it is if you stop the injections, it's like pressing a start button and the body just carries on developing. People acknowledge their risks, but as one medical ethicist at the University of Manchester noted, Anything is better than life in an alien body. And that is what is the motivation behind a lot of the
Right.
gender-affirming
The
medical approach.
motivation, yes.
Now, there's a doctor who was
Yes.
also on faculty at Brown, where I'm a faculty member.
Yes.
Her name is Lisa Littman.
I remember that in the newspapers.
Yep, and she was strongly pressured to leave Brown
Yes.
because of the research she did. And she had an article in PLOS ONE. It was
Yes.
entitled, Parent Reports of Adolescent Young Adults Perceived to Show Signs of Rapid Onset of Gender Dysphoria. She looked at 256 patients, 256 parents.
Yes.
80% had a child born female,
Yes.
okay, with gender dysphoria. The mean age of transgender identification, wanting to go from being born a girl to
Yes.
a boy, was 15. About a quarter of parents noted that their child had distrust of non-transgender people and a distrust of spending time with non-transgender friends. Half reported isolating themselves from family and trusting information about gender dysphoria only from transgender sources. So there's a behavioral term called social contagion. It's only getting information with this same perspective, where this is the solution to this terrible anguish you're feeling. This is the solution. So we all
Yes.
know none of us need a solution. That's not, as persons, we're not problems
Yes.
that need solutions. We're individuals where we receive love and give love. Love is the answer, not solutions
Yes.
in this regard. So Dr. Littman coined this term, rapid onset gender dysphoria, to describe particularly girls at birth who didn't express gender dysphoria till they approached puberty and then identified as trans. And there's a lot of shaming of many online groups of anybody who disagreed with trans affirmation.
Yes, interesting.
So folks were labeled, marginalized.
Yeah.
And parents and friends who were non-trans affirming
Yes.
were all called, well, they're transphobic. Don't listen to them. They're all transphobic. So only listen to this one point of view.
Yes.
And in fact, many online transgender peers encouraged others and scripted them to describe gender dysphoria feelings from birth and describe thoughts of suicidality to more rapidly receive blockers and cross-sex hormone therapy. Now, Dr. Lim has also gone on to do work on detransitioners.
Yes.
Those are individuals who medically or surgically transitioned and then regretted it
Yes.
and identified to the biological sex of their birth.
Yes.
In essence, a girl transitioning to a boy and now transitioning back, a detransitioner.
Yeah.
Okay, we can talk about that a little bit later.
Only 1 minute left.
Oh, only 1 minute. So we can talk about what these detransitioners are,
Yes.
and not what they are, but we can describe how it comes about. There's some very compelling interviews by Jordan Peterson with
yes.
Chloe Cole. And Chloe Cole has been online and has really been very vocal about this. She had double mastectomy.
Yes.
And she has talked about the severe regret. She wants so much to have a child.
Yes.
And she wants to breastfeed her child.
Yes.
To mother her child fully as a breastfeeding mother.
Yes.
But she's had a double mastectomy.
Yes.
It was not done against her will. She chose it when she was a teenager.
Yes.
But many teenagers, as we know,
Yes.
and many adolescents do change their mind.
Yes.
We have to acknowledge that, even though that's not a comfortable fact.
Yes. Well, you raise a lot of important, interesting issues, and we'll have to follow this up with next week's program. Same time, same channel next week.
Thank you, Ray. We'll talk more about this. I look forward to it.
Same here. Thanks, Tim.
Thank you. I like the painting, Ray.
Well, let's. Hi, welcome to the week 2 of Chapter and Verse. We're talking basically about gender dysphoria. That is, the sense that some girls think that they're really boys and they want to turn themselves biologically at times into boyhood, biological boyhood. And there are some boys who feel that they're really girls trapped inside a boy's body, and they want to become, the boys want to become girls. And the surgery, which has consumed us as a nation, it's become a political issue at some stages. The governors, there are several governors who have thrown their campaign to sensitivity to this issue, but it's become a cultural issue and a social issue, like abortion, like homosexuality, like other issues, social issues. And it's become really controversial. We were last talking about Lisa Lippman, a colleague of my friend Tim Flanigan, and she talked about how she used the word social contagion, the phrase social contagion, and that was the straw that broke the camel's back at Brown. It's a hot potato, and Brown didn't want to carry the hot potato, so off she went. And tell us a little bit more about Lisa Lippman, what she's doing now.
She's now looking at individuals who have expressed regret that maybe as a 12 or 14 or 16-year-old, they transitioned, and they may have socially transitioned.
Yes.
Or socially transition would be how they dress, how they act, how they express themselves, socially among others. Or they may have medically transitioned with puberty blockers and cross-sex hormones. What is that? That's, for example, an individual born as a girl would block puberty with these drugs and then take very high doses of testosterone.
Yes.
In order to bring forward body changes that correspond to a boy.
Yes.
Or they would surgically transition, which can involve even top surgery, for example, bilateral mastectomy. So these individuals that transitioned upon their request, but subsequently regretted it.
Yes.
And transitioned back to their identity matching their biological sex. I mean, they were born a girl and they are a girl.
Yes.
They are a girl. And a good example is you ought to go online and look at Chloe Cole. She was interviewed.
Cole? C-O-L-E?
C-O-L-E, Chloe Cole.
Yeah.
And she transitioned both hormonally and then with bilateral mastectomy.
Yes.
And there's a very poignant, very good interview with Jordan Peterson that I recommend.
He's very highly respected.
Very highly respected. And she's testified in detail about this, but we'll talk about it a little bit. So let's talk about medical transition, hormonal therapy.
Yes.
So first you get the puberty blockers.
Yeah.
So those are gonadotropin-releasing hormone agonists, also known, the trade name is Lupron, that can pause puberty. So for an individual born as a girl, it would stop normal breast development, it would stop menstruation, it would stop typical fat distribution. Okay?
Yes.
Then after that, an individual might go on to receive cross-sex hormones, which would be very high doses of testosterone. It turns out the idea that, well, we'll just block puberty, and then you can decide later. 90% of individuals that go on puberty blockers go on to cross-sex hormones. So this idea of, oh, just try puberty blockers and see how you do.
Yes.
Well, first of all, your body stops developing, and all your peers, their bodies are developing.
Yes.
You want to develop. You don't want to be caught behind.
Yes.
So, and in addition, there are a lot of emotional changes with puberty blockers.
Yes.
It's very hard to tolerate that. So no question there's emotional instability, mood changes, anxiety, and depression. and bone density can be significantly lower. So there are significant side effects of puberty blockers. So 90% go on to get cross-sex hormones. So if you are born a girl and transition to a boy, you have to get very high doses of testosterone.
Yes.
10 to 40 times beyond what you normally would have. And this causes masculinization.
Yes.
So what does that mean? Increase your muscle mass, your voice deepens, which is usually permanent, change in body fat, and the vagina and the uterus will atrophy.
Yes.
It's not uncommon for someone who's been on 5 or 10 years of testosterone therapy with severe atrophy of the vagina or the uterus to want to have a hysterectomy.
Yes.
It's painful there. Certainly can't also, vaginal intercourse is painful, and it causes severe atrophy there. So if you're born as a boy and want to transition to a girl, you have to take very high doses of estrogen.
Yes.
And that also has a lot of side effects in order to cause feminization.
Yes.
So breast changes, body changes. It causes a lot of emotional lability, a lot of instability, and of course you get atrophy of the testicles.
Yes.
Now, if you stop the cross-sex hormones, you stop the testosterone or the estrogen or similar hormonal changes, some effects like facial hair, body changes, some of that may not go away, may be permanent.
Yes.
And there are concerns that there'll be changes in fertility. So some of the changes are transient and some may be more longer acting, longer lasting, and we're trying to work that out. So let's say you have gender dysphoria.
Yes.
You feel you're born as a girl, you want to be a boy. You go on puberty blockers.
Yes.
Well, everything stops. As soon as you get high doses of testosterone, you feel affirmed. Wow. You feel supported. You feel like you can pursue who you're meant to be.
Yes.
And by the way, very high doses of testosterone give you lots of energy.
Really?
Oh, yes. Makes you feel like, oh, boy, I feel better.
Yes.
So there can be a euphoria with that affirmation.
Yes.
But you know what? It's usually not enough.
No.
You say, well, gosh, but I still have increased breasts. Maybe I should have top surgery.
Yeah.
And take off these breasts since I'm a boy, not a girl.
Yes.
And even though you may undergo that, you still never have a body of a biological boy or a body of a biological girl, right?
Yes.
You just change the characteristics. So there's always a sense of desiring to do more. And that can be very, very difficult for many individuals. So is there data on long-term follow-up? There is. In Sweden, they did a 30-year study of 324 individuals who underwent sex reassignment.
Yes.
324
That's
underwent
the
sex
complete
reassignment.
thing.
Yep, they looked at standardized reporting. They found that those who had sex reassignment over the long run had much higher mortality rates, had much more suicidal behavior, had many more psychiatric hospitalizations. And so therefore, the sex reassignment did not, solve the problems.
Yes.
And it's this whole approach of gender dysphoria, nobody is a problem to be solved.
Yes.
An individual is a person to be loved, to be listened for, and to be cared for.
Yes.
And the gender affirmation model tends to promote a sense of this is a problem and we can solve it.
Yes.
Technology,
Yes.
hormones, surgery, nobody's a problem to be solved.
Yes.
We're all a mystery to be loved, like we talked about.
Yes.
And we'll play a song at the end that talks about that. Now, the largest gender affirmation clinic in the United Kingdom was called the Tavistock Center.
Tavistock.
Yep. And it was declared by a court to be unsafe for children.
Really?
And this happened because Kiera Bell, she was a young woman who transitioned quickly and now regrets it, and she sued the National Health Service.
Yes.
When she was 16, she visited the gender clinic and was soon prescribed puberty blockers. And I can tell you, many gender therapists, when you articulate that you are this gender, different from your biological sex, the whole approach is to affirm the gender that you identify as.
Yes.
So, and the next, what follows from that is, let's block your development of puberty in the wrong gender.
Yes.
So she received puberty blockers. A year later, This is a common story. She was given testosterone. She was referred to the adult gender clinic to receive a double mastectomy after 2 appointments at the age of 20. She requested all of this. Nobody
Yes.
did it to her.
Yes.
She relates that none of the clinicians addressed Kiera's underlying issues, such as her anxiety and depression,
Yes.
stemming from her childhood rape and alcoholism and domestic violence in the home.
Oh.
So they did not address her underlying issues, but just wanted to just address the gender dysphoria.
The same is true of people in Canada, Belgium, the Netherlands, who are undergoing euthanasia counseling. Actually, I should say, who are not undergoing counseling. They're trying to work with children now.
They're not addressing their anguish,
Yes,
their depression,
exactly.
their anxiety. So the National Health Service reviewed the experience of Tavistock and said there's lack of research, there's
Yes.
concern over harms, and these children are being fast-tracked
Yes.
for transition. And they said we need to stop this approach.
Yes.
We advise therapeutic or interventional caution. Okay? So, and you know what's happened? Gender clinics in Sweden, Norway, Finland, and in the Dutch National Health Service have all dramatically slowed the process. Dramatically slowed it. Unfortunately, in the US, there's been an explosion
Yes.
of gender-affirming clinics, programs, and providers.
Yes.
Many of them are in family medicine. The first clinic in the U.S. that was best known was at Johns Hopkins. They did
Yes.
research on long-term follow-up by Dr. McHugh, and he showed no measurable improvement of the patients who underwent sex reassignment surgery.
Yes.
Dr. John Meyer, who did the sexual behavioral consultation unit, said there's no difference in long-term adjustment between transsexuals who go under the scalpel and those who do not. He said, my personal feeling is that surgery is not a proper treatment for a psychiatric disorder. These individuals have severe psychological problems that don't go away following surgery. They closed the gender identity clinic in 1979. 38 years later, 2017, it was reopened. Right now in the United States, many gender-affirming care programs, many Planned Parenthood clinics will give puberty-blocking drugs quite after a rapid assessment, will give cross-sex hormonal therapy, and will refer quite rapidly for transsexual surgery. Now, these clinics are growing. What about the individual? What about the child? What about the adolescent? And what about the patient? So Patrick Lappert, a plastic surgeon, also a deacon, as he put it, you cannot heal a broken heart by operating on people. You can only heal a broken heart by loving that heart and letting them know how deeply they're loved by God who called them into being. Jason Everett said, each person's story is different. They need to be listened to. They need to be cared for. They need to be understood as individuals with their own story. And we need to care about them as persons, not as a label, but as persons. No one is a problem to be solved, but everyone's a mystery to be loved. Now, if you're interested, this is a picture right here of a very interesting psychiatrist, Dr. Kaltiala. And she was a psychiatrist in Finland who started their transgender care program and followed very closely and did the research. And she now feels that unfortunately, that the approach that is being followed in the United States is causing great harm.
Yes.
So I can quote to you what she says. In the U.S., the first pediatric gender clinic opened in Boston in 2007. 15 years later, there are more than 100 clinics. As the U.S. protocols developed, fewer limitations were put on transition. A Reuters investigation found that some U.S. clinics approved hormonal therapy at a minor's first visit.
Really?
Yeah. The U.S. pioneered a new treatment standard called gender-affirming care, which urged clinicians simply to accept a child's assertion of trans identity and to stop being gatekeepers who raise concerns about transition.
Oh.
So it's really funneling folks in.
Yes.
Now, around 2015, in addition to very psychiatrically ill patients, a new set of patients starting to arrive at the clinic in Finland. they started to see groups of teenage girls,
Yes.
usually 15 to 17, from the same small town,
Yes.
or the same school, or the same friend group,
Yes.
telling the same life story and the same anecdotes. All of them with the realization they were transgender, though they had no history of dysphoria.
Yes.
We realized they were networking and exchanging information about how to talk with us.
That's exactly what we've been
This was
told.
social contagion-linked gender dysphoria, and
Yes.
this was happening around the world.
People were asking the question, how come the guys don't go together to the clinic?
Yep.
And why do girls do it? Well, it's like when girls go to the bathroom at an event or a dinner or something like that, they go with another girl. There's a social aspect to this.
Social aspect to it. I think that's a good way to put it. And she now has noted that there is significant regret. Many people say, oh no, it's less than 1%. She said, oh no. One study showed that nearly 30% of patients who were evaluated stopped filling their hormone prescriptions within 4 years. They stopped, not because they couldn't get it, they stopped because they were having second thoughts.
Yes.
And for many, she found that for many of females born as girls transitioning to men, that it took years for the full impact of transition to settle in. This was the case with Chloe Cole, which you can listen to online. And when young people who have entered adulthood confront what it means to possibly be sterile, or to have damaged sexual function, or difficulty in finding romantic partners, they have second thoughts. And she says, this is her quote, "It's devastating to speak to patients who say they were naive and misguided about what transition would mean, and who now feel it's a terrible mistake. Mainly these patients tell me they were so convinced they needed to transition, they concealed information or lied in the assessment process."
Wow.
Now in Finland, they had the release of a major medical body, the COHERE, which said, release its findings and recommendations on gender transition. It concluded that the studies touting the success of gender-affirming model were biased and unreliable systematically in some cases. And the authors wrote, in light of the available evidence, gender reassignment of minors is an experimental practice. It's experimental. Young people seeking gender transition should be instructed about the reality of lifelong commitment to medical therapy, the permanency of the effects, and the possible physical and mental adverse effects. The report warned that young people whose brains are still maturing lack the ability to properly assess the consequences of making these decisions. So the authors concluded that for all these reasons, gender transition should be postponed until adulthood.
Interesting.
Postponed until adulthood. And the UK, Sweden, and Finland, and the Dutch centers are all moving in that direction, whereas the US, many of our gender-affirming care models are moving in the opposite direction.
It's terrible what's happening in America. There's a judge in Canada, there's a judge, I think, in Ohio, the United States, who said that if he noticed any criticism by parents to the operation of their children or to their treatment of their child, he will remove the child from the home and place them with unknown to the parents, foster parents.
What's happened is, if an individual is not affirmed, anybody who might say, let's think about this, let's wait a little bit, is considered transphobic. So they're labeled as bad people.
Yes.
And that is such a difficult, painful thing. And remember that many individuals with gender dysphoria, all their source of support is in the trans community. So they're not hearing other perspectives and other voices, and so it's very difficult for them to make a measured judgment. In addition, they're requesting the therapy. I don't in any way want to imply that the patients and the care providers all believe they're doing what's best for them. It's just the data from many of these countries are showing otherwise, and the rise in detransitioners is increasing, and there's a real attempt to silence any voices who disagree with the gender-affirming care model.
Yes.
So now, for me, this is all about the person. What's happened is, unfortunately, that the battling is so terrible that people have forgot the child in the middle.
Yes.
Who's in distress. And I started by giving the lyrics for a song, Never. And I would love to play it.
Yeah, let's try it.
And I think you would enjoy it very much here. Because you'll see, and I think this is a song that talks about caring for the individual. This is by Tasha Layton, and I'll turn it up. Never forgotten, never forsaken, never abandoned.
Is she a deacon?
No, she's a wonderful singer, Christian singer, Tasha Layton. But you can see that her concern is not who's right, who's wrong, which ideology is this or that, but that each person is loved and cared for, that our Lord will comfort us, will heal our wounds, will nurture and care for us. But we need to listen to individuals that are struggling with gender dysphoria. We need to spend time with them. We need to understand them, and that we don't want to fix them. We need to love them, and they need to love us. We're all created to love and be loved. And that's what we're called to do, not fix others or be fixed with medical technology.
And thanks to your quotations today, bringing us the words of people who are in the thick of it, and in an intellectual, an auspicious intellectual position to be able to tell us the truth, even a truth which is lasting for a long term. The people who are listening to this program today and last week are going to be better able to talk with their children and to listen to their children.
To listen. Nobody should ever be rejected, ever.
Yes.
Even if they're expressing opinions which are difficult for you to accept.
Yes.
We just have to listen, love, and spend time. And not easy. But you can learn more about this. You can look up Lisa Littman, the Brown physician who did this great work. You can look up Chloe Cole. She's the girl who transitioned to a boy, both medically and surgically, and detransitioned back, and her testimony is very moving and very important. And you can also look up our psychiatrist from Finland, who's really very articulate, and she's written a number of articles that's asking us, please, in this country, reconsider, pause, stop. You know, you really need to think twice. So it's Dr. Kaltiala. I always look it up because
How do you spell that?
Kaltiala, Kaltiala. Here's I'll show you a picture of her. She's been very bold and outspoken, and you can imagine that many individuals in the medical profession who are that are real strong proponents of gender-affirming care, she's been attacked. So anybody who questions the gender-affirming care model, usually you're going to get beaten up a little bit.
There's a divisiveness.
Sorry?
There's a divisiveness in our.
It's very divisive. Yeah, it's very difficult.
In a lot of subjects.
Yeah.
All the controversial issues have people with daggers in their mouth.
People want to get you. This is also another book, Male, Female, and Other, by Jason Everett. Very, very good, and I strongly recommend it too.
Yes.
This is detailed, tons of references, really good quotes, but it's very informative and really helpful. So it's really an important area. Ray, you're bold to ask that this be spoken about on your program. A lot of other people would shy away and say, oh, don't talk about that.
We'd really like to promote understanding. I remember listening to a Rod Stewart song, and the song was about a guy and a girl from normal families, I guess, and they disappeared into the night. And their parents didn't know what to do.
Yes.
And they searched their minds and couldn't come up with anything. And Rod Stewart, or narrator, I guess, of the song, said that they just didn't listen. They just didn't listen to her. They didn't listen to him. They found each other and disappeared.
Hard, isn't it?
It
we
is.
all
Broken heart.
All of us count.
Yes.
All of us have great meaning. All of us need to be listened to, need to hear and need to express. And at a much more fundamental level, we all need to love and be loved. Not used or fixed, but loved and be loved. We have been called into being. Really, the
Yes.
act of our existence is so beautiful and so wonderful, but we do experience terrible pain, and we have to help each other through that.
You and I were lucky enough to become friends of Malcolm Muggeridge.
Yes, he was extraordinary.
And I gave you a copy of an essay, part of an essay that he wrote. I was talking with him once over the phone,
Yes.
and I said, his essay was about the sanctity of life, the preciousness and value of life.
Yes.
Even though he was an elderly man and he felt he was going to be leaving us into death in a short time, he was, and that's the spirit that he had. I asked him about this. I said, Malcolm, some of us love you, and we'd like to keep you around a little bit longer. We'd like to use you. I know I meant that in a funny way. And he said to me, life is like a night in a third-rate hotel. And then he corrected himself. He said, no, life is like a night in a fourth-rate hotel.
That's funny.
Yeah.
Oh, that's funny. I visited him in England.
Yes.
He was a very good friend of Mother Teresa of Calcutta's. They had a
Yes.
great friendship together.
Yes.
Even though when they met, he was a total atheist. And
Yes.
she was a total believer.
Yes.
And it was interesting that was not a problem. They became deep, deep, deep friends.
That's wonderful.
He loved life. He loved her. He was extraordinary, and he didn't mind telling the truth.
Yes.
And he took it on the chin.
He
got
did.
a lot of grief from it.
Yeah, he did.
But he
Thrown out of Russia as a reporter.
Oh, he was. He
Well,
was
the
correct.
others, the New York Times and others, they went and countenanced genocide by the millions of people.
They did. Well, a lot of people find it more convenient to close their eyes to some of these difficult issues
Yes.
and just go along and sort of smile and say, yes, yes, fine, fine, when things are not fine.
Yeah, they'd want a Pulitzer Prize and a nice cush job supplied by the Russian aristocracy. I shouldn't say that. They would say that we have.
It was the Communist Party. It was under Stalin. It was under
yes.
Stalin, yeah.
Yes. Well, we have less than a minute. Was there anything you'd like to add?
No, but thank you for having the show, and thanks to our listeners who are joining us. And let's all ask that the God who called us into being and who loves us so much that God pours God's grace upon us, and particularly those that suffer from gender dysphoria, their families, their friends, and recognize that their journey is painful and difficult, and that their anguish and depression is so real, and they need all the love and support and listening and caring that we can give. That's the best approach.
Yes.
To those individuals, and that will be a huge help, not just to them, but to us. We need to give it too.
Yes.
I mean, it's both ways. That's the best approach.
Yes. Jesus said, love and peace.
Yes. Thanks, Ray.
Thanks you very much.